Katie. It's been a few weeks since we've seen each other last, so it's good to see you. How are you doing?
I'm doing okay.
Yeah? Just okay? What's been going on?
I've just been really busy. I have a lot on my plate right now, and I'm just really feeling it.
Yeah. Well, I know that one of the things that we've continued to talk about the last couple times that we've met are specifically anxiety, but just generally stress. And I know last time before, we got done, I had walked you through what's called box breathing, and I invited you to sort of utilize it whenever you're especially overwhelmed. And if you remember, you basically take a deep breath that lasts 4 seconds, hold it for 4, exhale for 4, and then you basically go 4, 4, 4, and then 4. So I don't know if you're comfortable with this, but just given that we're bringing a lot into this room right now, I wonder if maybe we could just do a couple box breaths just
Okay.
start out, if that's okay with you. So, and of course, you feel free if you want to, if it's more comfortable for you to close your eyes, leave them open, whatever you like to do is fine. So,
Okay.
and I'll do them too as well. So. I know I haven't given you a whole lot of time to do box breaths, and it also feels a little forced to do it, in therapy with a therapist and that kind of thing. But how has that worked for you? How do you feel even now doing box breathing? Has that been helpful at all with your stress and anxiety?
If I take the time to actually do it, it does help.
Okay. So there are moments when you've just got, too much going on, you really don't have the time to
Or some of the moments
utilize the
that
practice.
some of the moments that I experience anxiety, I'm not by myself, so I feel less comfortable to do that exercise with other people in the room, or especially if during that moment I have responsibilities that I'm supposed to be taking care of. Because as you know, I'm a teacher, and I can't just stop instruction in order to take box breaths unless I have the students do it with me.
Which is interesting too, maybe incorporating some of these exercises into the classroom with your students. Of course, that's not what this time is about. It's about managing your own anxiety and stress level, but of course I imagine that would be helpful for you to share with them and basically be a communal practice potentially. I want to revisit one other thing that we talked about last session, and that was this thing called the cognitive model, which I know the terminology can be somewhat scary, but it's just this basic idea that we have these experiences in the world, in the classroom, and we have an experience, and what it does is there's this cascade effect where it leads to a thought, which leads to emotion, which leads to a behavior. And so last week, in addition to practicing box breathing, one of the things we had talked about was, let's start with our behaviors. Let's look at our behaviors and sort of work our way backwards. And so I had actually invited you to try to log those moments when you were feeling especially anxious or stressed. And so I don't mean to put you on the spot because I know you don't actually have your log with you today, but if you can think back over the last few weeks, assuming you've kept a log of these specific moments when you felt anxious or stressed, I wonder if there's one or two maybe that stick out to you, and if we could just maybe talk through them utilizing this. Okay, this is the thought, the emotion, and the behavior that I experienced in response to some form of trigger.
Okay, so you already know that I feel like I have 3 primary roles in my life right now. I am a parent, a mother of a 3 and a 5-year-old boy, and I feel like that's one of my main responsibilities, one of the main roles that I take on. That I am a full-time teacher of a first grade classroom, and so I find that role responsibility to be very important. I want to do my best job there, and then I'm also um, getting my master's right now, so I'm a full-time student as well, um, in an accelerated program that wraps itself up in a year. So like in the last week, the weight of all those individual responsibilities has just really bared down on me. That the moments of anxiety that I felt in the last week relate to each one of those jobs. So like one day last week, I was taking a test, a time test on the computer for my master's after I had put the boys to bed. And during my assessment, one of my children starts crying, and he's throwing up for the first time in his entire life.
Wow.
All over himself and his bed, and he's freaking out about it. And I have to stop taking my quiz and just leave the computer going, and then give him a bath and change his clothes and calm him down and clean his bed.
While the test is
still ticking.
Yeah, that's super stressful.
And then that, like, being, I guess, a pinnacle of parenthood, that was a lot.
Was there anyone else there that could have, like, helped you
No,
with this
I was
situation?
home alone at the time. But fortunately, I do have my mom who lives next door. So after I'd gotten my youngest son bathed, I did call her to just help me get his bed sheets clean, so that I could calm him down while she did that, and then we could get him to bed. So it was nice that I have her next door to be able to help with that, and she did come pretty quickly after I called.
Wow, that's a lot to have happened in just a short span of time. You have this test that you're trying to take, you have this unexpected thing that happens on top of it that you have to respond to, and how is one supposed to even really take care of all of these things as they're happening at the same time?
Well, that's just an example, but I use that as an example to say, like, it's hard to be a full-time parent and at the same time have other full-time jobs too. Because I didn't even mention in there to be not only a mother, a teacher, and a student, but to also be a wife and a friend, all that. So other places that I felt anxiety this week were I had a surprise evaluation at work. This is the second observation that I've had in the last 2 weeks, and I already felt uneasy about one that I had last week.
Yeah.
And I didn't feel super great about this one either. I have a challenging class this year. I think it relates somehow to what we're experiencing in the classroom, in light of COVID. My first graders were the first graders who didn't have but half a year of preschool, and their kindergarten year did not look normal at all, and they're just more immature as a whole. So, and academically, they're not as independent, and you can sense that, feel that in the room, that they are leaning on you a little bit more than the average first graders at this point in the school year. That in some ways they act more like kindergartners, but in kindergarten they had 2 teachers in the room. They had the teacher and the assistant, but now they just have you.
Yeah.
So it can get, at moments, that makes the room feel very needy, and I definitely have this inclination that I have to keep it all together for everyone.
Is that something that you feel a lot? That need to keep it all together for everyone in all of the different roles that you've described?
Yes.
Yeah.
And when I had my evaluation, I haven't heard back from how the first one went, but the unannounced observation, I did meet with my administrator on Friday, and my scores were not the greatest. In fact, they were the worst scores I've ever gotten in my entire 10 years of teaching so far. Like I said, I've got a lot on my plate this year, and so it was just super disheartening and discouraging because they only get a quick snapshot of the entire school year, and they get it all in like one lesson, 1:45 to an hour long lesson, and they evaluate you on that. It uploads to the database, and it's on the computer with your record forever. And it's not that anybody even looks at it. I recognize that most people don't. They want it as a teaching tool.
Yeah, but you want that evaluation to reflect the effort that you're putting in, and to reflect you well professionally. And so when you say that they're just getting a snapshot, but I can sense that what you're saying is they're not there 24/7. They're not seeing all
Well, and they
you're
don't
doing.
know the
They're not
story
all
of
you're
each of my
investing.
individual students and what challenges they're dealing with as individuals, and what circumstances they're having to work through
And you
as
do,
well.
because
And
you're
I do,
there.
because I'm there every day, and
Yeah.
I know why little Johnny gets up out of his seat constantly, and I know why little Susie it cries at the drop of a hat.
Yeah.
I know why so-and-so turns off their computer 2 minutes into their independent activity out of frustration for not knowing how to do it. Like, I know the reason why my students behave the way they do.
There are a few things that I hear, in this, and I invite you to correct me if I'm wrong, but the two primary things I hear is that, one, you have a lot of roles that you have adopted. I mean, you named at least 5 of them that I heard, of teacher, parent, student, wife, friend, and in the little time that I've gotten to know you, I also get the impression that these roles are important to you, and you want to fulfill them to do well. You don't just want to teach; you want to be a good teacher. You don't just want to be, a parent. You want to be a good parent. And there's a certain pressure that comes with. There's a certain expectation, I get the sense, that you're placing on yourself, or that you've internalized from somewhere else, from someone else, and that makes it just that much more stressful and that much more overwhelming.
But not only do I feel like other people have high expectations or high needs that I have a responsibility to meet, but I also have really high expectations for myself.
Yeah.
And it's not necessarily something I think that someone's taught me to be that way for as long as I can remember. That's just been how I am.
Yeah. So let's use the situation of you're taking the test, your son starts throwing up, and it's just like everything's happening at once. Or you're in the classroom, for example, and you're getting observed, and you had this idea in your head of how things were going to go. You had put a plan together, and everything's just not going to plan. What are you feeling in that moment? Like, what are you thinking? Like, if we started with the behavior, and we take a step back to the feeling and the thought, what's going on in your head in those moments? What are you thinking to yourself? Do you feel in control? Or do you feel out of control?
I mean, I don't have control in those moments necessarily.
And what is that like for you?
Well, I think I'm calmer in the situation with my own children at home. Because I guess maybe like it's the mother instinct or something, that I wasn't necessarily as concerned about the quiz.
Yeah.
That it was easier to comfort my own child in that moment, because I think that's what I knew he needed the most from me, was me to be fully present with him in that moment. So I think in that moment I'm able to give more of myself to him completely.
Yeah.
But I think in the school situation, when I'm being observed and when some students are off task and need redirecting, I feel that anxiety differently because more people are watching.
Mm.
And I think I get much more stressed in those moments because there are eyes on me. and both the eyes of an adult who's evaluating and scoring, and the eyes of the children, because I know first graders are intuitive. I know they sense energy, and I know they know me well enough to know when I think I start giving off a certain energy.
Yeah.
And I know that my energy then impacts their energy. Like if I start to have an anxious presence or a frustrated presence, then they start to get that way too.
That's interesting. I say
and,
that because
and then once it starts, they start getting that energy. It kind of just snowballs.
Yeah. So there's an element here which you had described where, like, say at home in the presence of a child, if something happens that's unexpected, it may cause some stress, but it's not anything you can't manage. But in a school setting, when you've got supervisors and teachers and evaluations and parents,
it's not my own child, so it's someone else's.
There's an added element of evaluation. Of someone,
because I know that everybody is a critic,
potentially judging.
And I do have this narrative that I know I play in my head because I played it my whole life, which is nothing I ever say or do ultimately is ever good enough. I have family situations where I've tried to be the perfect daughter, and for the most part I would say that I've been a really good kid and a very good daughter, as far as like not letting family down or not making poor choices or not creating work for people, yet somehow it still wasn't good enough to have someone's unconditional love and acceptance. Like, I think I have a lot of situations where ultimately at the end of the day I feel like nothing I say or do is going to be enough.
You're actually tapping into something that's true of all of us, that we all have core beliefs. And a lot of these, you had mentioned this is something you've struggled with your whole life, or this is something I've thought my whole life. And that's true of all of us, that we, due to circumstances, experiences, good and bad, we developed these beliefs about ourselves. And oftentimes they are partially true, but they're not the whole truth. And what I hear you saying is that one of your core beliefs is that I'm not enough. I'm not good enough. But I also recognize that there's a tension in you where you say, I've been a good daughter, I've been a good student, I've been a good teacher, and still, and there insert the core belief of I'm not good enough. And when we think about that cognitive model of like the behavior, the feeling, the idea, something happens at home in the classroom and it's overwhelming. You feel a certain way, you behave a certain way, but underneath that is that core belief of I'm not enough, and in a lot of ways that fuels the feeling and fuels the behaviors. So it'd be interesting to explore. The way I often talk about it with people is explore core beliefs, put them on trial. Is this actually true about me? Other people's core belief may be I'm not valuable, or I have nothing to offer, but let's say it's I'm not good enough. Putting it on trial and looking at the evidence. Is this true about me, that I'm not good enough? What does it mean to be good enough? Instead of being burdened by the expectations of others and burdening ourselves, what would it look like to try to craft a sort of a healthy, what is enough? Maybe that's a good question for us to explore. What is enough for you to qualify as good parent, good teacher, good mother, good friend? What is enough? Because it's not possible to do everything in every role. Your resources aren't inexhaustible. You only have so much time. You only have so much energy. So you can't do all these things perfectly. So what does it look like to be good enough at all the things you're trying to do? And is it possible? Does that make sense? I mean, that's a really challenging thing explore, but I wonder if you could develop more realistic expectations and a healthier core belief, if it might be a little easier to mitigate some of this stress and some of this anxiety.
Well, I feel like I have an easier time extending my self grace. Like I said, when it's around like my immediate family or like the ones that I know I'm closest to. It's when I go a couple clicks out or a couple circles out that some of the strategies you mentioned and that sort of thing just doesn't seem like
that inner critic, that voice, it's like the volume
I
gets
can extend
turned
my
up.
self-grace, yeah, to an extent, but when the other voices around me get louder than my own, then it can become really discouraging and almost off-putting, where you just want to quit and stop trying at all, either in that one role that there's a lot of criticism in, or in all your roles all at once.
I noticed you're getting a little bit emotional. Is that how you feel right now?
Yes, I'm very put out by all of my roles right now. I just want to go on a vacation and not do any of the roles.
Yeah, I feel that it's overwhelming. It's a lot. I'm sorry that you feeling that kind of heaviness right now with all that you're trying to do. Well, unfortunately, we're kind of coming close to the end of our time. I know that this is there's a lot going on in the room in terms of, things we've talked about and things you're feeling. Is there before we sort of wrap up, is there anything more that you were hoping to say or anything you want to share?
Well, I guess maybe just ask your advice in what I know is coming up, which is, like I told you, I've had 2 evaluations in the last week at work, and I've heard back from one of them, but I haven't heard back from the other yet, and I'm not being optimistic at the moment as far as this is already done by an administrator that I find very intimidating. And I'm wondering, like, what mindset should I have, or what practices should I be doing in preparation for that conference with this administrator in relation to my teaching. Because I have a feeling I will take it very personally.
Yeah. Well, I think what I would, you can take it or leave it, but I think one of the things that's important to recognize about anxiety is that it's future oriented. That what generates anxiety more often than not in us is anticipating a future that hasn't actually happened yet. And so there's a certain amount of planning that we have to do, preparation, but if we're not careful, we can imagine a future that hasn't happened yet, only to create anxiety in ourselves about that thing that hasn't happened. So given the fact that you've already had the evaluations and you've done your part in terms of in preparation for meeting with these supervisors and administrators, I don't know if this is going to be satisfying, but what I would do is try to come back to the present as much as possible. When you have those thoughts, speaking of the cognitive model, you have those thoughts that generate the anxiety in anticipation of the thing that might happen. I would come back to the thought, and what I would do is, instead of entertaining what could or what might happen in the future, I would try to come back to my breath. I know you can't do box breaths necessarily in the middle of the classroom, but if you have these moments where you're thinking about, oh gosh, I'm so anxious that's going to happen, come back to this moment, because it's not happening right now. And you don't know how that meeting's going to go. You can imagine it's going to go a certain way, or anticipate it's going to go a certain way, but you could also be very surprised at how it goes. You might discover that the person that you think is going to be most critical might be most gracious. And it might be better for you to entertain the possibility that that's what's going to happen. Instead of entertaining the possibility they're going to judge you, what if they're actually going to extend grace to you. And to even celebrate, acknowledge how much work you're putting in, acknowledge how difficult your classroom is, and actually celebrate you instead of judge you or evaluate you in a really harsh manner. But even then, we don't know what's going to happen. So maybe coming back to this moment as much as possible whenever you find your mind wandering into the future, trying to come back and be in this room with what's happening now. That may not be satisfying, I don't know, but I'm not saying there's any easy answers in this regard, but in as much as you can be here, maybe that can bring down that anxiety level. Yeah. All right.
Okay.
Well,
Try.
Now that we're done, maybe we can go ahead and go downstairs and we'll talk to the receptionist about getting another therapy session, on the calendar. In the meantime, if something comes up and you just feel like you really could afford talking to somebody, then of course call up here and I can try to make time between appointments to speak with you. So.
Okay.
But I'm wishing you all the best.
Thank you.
Yeah, this was good to see you again, Katie. Thank you for coming in. Yeah, we'll see you again in here a couple weeks. Okay.
Okay.
All right. Take care of yourself.